If you don't clean your implant all-on-4 denture, what do you think is going to happen? Do you feel that just because the teeth are gone, that you don't have to go continue to get your cleanings done? That's the biggest misconception there is. Having an all-on-4 denture is a big, big investment. This is something that a lot of people invest money in to replace the teeth that they have missing or had to lose due to health reasons or whatever the case may be. There's a lot of different reasons why people lose their teeth. But once the teeth are gone, a lot of people think that they don't have to go to the dentist anymore to get cleaning. They're like, hey, my teeth are gone. I've got implants now. I don't have to worry about getting cavities. And that is true. But there's a lot of other things that you need to take into consideration when you're thinking about having this done. So with that being said, here's a few of the things that you need to think about. When we have our natural teeth, right? A lot of people at this time, at this stage, of course, there's usually gums here, but this is how the teeth look in the mouth, will say, I brush, sometimes I floss, I don't have any issues. A lot of people don't go to the dentist unless something actually hurts. But in that situation, this is what happens. You don't go to the dentist, you just go about your day brushing and, taking care of your teeth. If you're lucky, you have one of these really cool, like ultrasonic toothbrushes that do all the work for you. But some people just use a manual toothbrush and regular toothpaste and they think that that's just fine. If you don't brush your teeth, a lot of times what happens is you get a lot of tartar and plaque buildup around the teeth at the neck where it goes underneath the gums. That's called the sulcus. Once that happens, all that tartar plaque buildup gets underneath the gums and it sits around the bone of the tooth, and then it just starts to eat away at the bone, therefore causing what's called periodontal disease. At that point in time, the bone will just start getting less and less and less until the teeth eventually get loose and fall out. You start to have really bad breath. There's a lot of different things that happen. But back to the subject at hand is the same thing that can happen with your natural teeth if you don't go to the dentist to get these cleaned every 6 months as recommended by the ADA. Then you can also get that same tartar and plaque buildup around these implants underneath the bone. Now, even though you cannot get cavities on these implants that are in your jaw, you can still get bone loss, okay? Which would cause these implants to fail. And then guess what happens? Your prosthesis will fail and there go your teeth, right? So when you're thinking about getting this done, please, please, please just know that there's a maintenance cleaning that goes in to having this done. You have to come in every 6 months, at least here at Summit Point Dental. This is what we recommend. Come every 6 months for your regular checkup and cleaning. We're still going to take x-rays. Other than monitoring the integrity of your implant, we're also going to check all the parts and components. There's 3 different parts that go on top of this implant. So there's the screw, which is the implant itself, which is made out of titanium and is also MRI friendly, just in case, because I know a lot of people always ask these questions when they come in and they're asking questions about having this procedure done. There is what's called an MUA. It's a multi-unit abutment that connects to the implant that goes above the gum, and then this prosthesis connects to that MUA with a screw. If you look closely, there are screw channels here. Those little holes are where the screws go that connect to the implant directly underneath, which is what fixes it for you to make it not come off and on. Now, of course, with their zirconia, they're a little bit prettier. That was just my other little acrylic model, just to kind of show you how it works. But these are just as good as your natural teeth. The good thing about these, and the reason most people get them, is because they're going to stay looking like this forever, as long as you take care of them, of course. The color is not going to change. You really can't stain these as long as you're brushing, which we do recommend you do brush. Like I said, this is what we have here at Summit Point Dental. We do the Oral-B power brush, right? And it's basically tells you when you're pushing too hard and not. This will clean everything off for you, and you're going to want to go underneath and on the back side and everything for 2 minutes. That's top and bottom. Other than that, the next step to keeping this clean on a daily is water picking, okay? This is what we carry here. This is our Oral-B water flosser. Now, you don't have to get this brand. There's plenty of brands out there. And what happens is you're going to use that water flosser. That water flosser is going to be directed, basically it's like a power washing machine. You're going to direct it directly in between the gums and the prosthetic where it meets, okay? Right in that little crevice. Now, it's going to have several different settings. You're going to have to build yourself up. We always recommend starting at the lowest setting until your gums get tough enough for the pressure. Imagine power washing a house that is like siding, and you put it on the highest pressure there is, and then you break all the siding. It's kind of like that. So you're going to want to start off on the lowest setting, but you want to make sure that you slowly build yourself up and keep turning the nozzle up until it's comfortable for you and you can physically feel the water shooting through all the way to the other side. You're going to want to do both sides of your prosthetic. So you're going to run it across the front several times. Then you're going to go inside the mouth and you're going to run it across the back side. You just want to make sure you're getting everything out from under there. Now, don't get me wrong. This is man-made. It's made to rest right up against your gums, and there should be no spacing. But plaque and tartar can get anywhere. We still have good and bad bacteria, and we also still have our salivary glands located in the corners of our mouth and underneath the tongue. So with that being said, that is what produces, between that and the good and bad bacteria, is what produces the tartar and plaque, besides the foods and stuff that we eat and the drinks and the acidity. So depending on our diet and depending on how well we clean is going to tell you exactly how long this is going to last you and if your all-on-4 implant procedure is going to be successful. Here at Summit Point Dental, we're going to do everything in our power to make sure that you are successful. And our hygienist here, his name is Oscar, is specifically trained in all-on-4 cleanings. There's a lot of dental offices out there that have dental hygienists, but a lot of them aren't specifically trained on cleaning implants, and there's a very special way to do it. Now, when you come in, we're going to take our time with you. We're going to unscrew everything. We're going to remove your prosthetic. We're going to steam and sterilize your prosthetic for you. So this way, once we put you back together and put everything back in the way it goes, all your parts and pieces will be completely clean. We're going to check all the screws. We're going to check the MUAs and make sure they're nice and tight. And with those x-rays, we're also going to make sure that we are not seeing any signs of early bone loss. And we're also going to educate you on areas that we see may be a problem when you're doing your cleanings. If you're collecting food in one area, if the gums are bleeding, that pretty much tells us what areas you may need to work on, okay? So back to what we were talking about. If we do not clean this procedure, the worst thing that can happen is that you're gonna have implant failure. You're gonna lose these implants, and then you're gonna lose your prosthetic, and you're gonna have to go through the whole procedure all over again. So this is something that is very, very important to us here at Summit Point Dental, and we just wanna make sure that you know exactly what is gonna be expected of you once this procedure is done and once you commit to this type of treatment. This could be your best friend, and it could also be something that does require a little bit of maintenance, but it's worth it in the end. It's going to give you a better quality of life. It's going to give you that smile and confidence that you want when you walk into a room where you meet people, and be able to just light up the room whenever you're smiling for family photos at family events, when your grandchildren are born or your granddaughter's graduating high school or getting married. So let's just think about all of these things and notice how important it is. If you're lucky, if you're one of the lucky ones that takes care of your teeth really good and you go to the dentist every 6 months, then that is amazing. But not everybody was raised and trained to know how important dental cleanings are. And once we get past that point, that doesn't mean life's over for you. We can still help you, and we would love to help you here at Summit Point Dental. But if we get to this point, whether it be for whatever reasons were that you lost your teeth to begin with, this is your second chance. Just want you to be aware of that. Dr. K, which is Dr. Kotobosh, and myself have been doing this for a really long time. Between the two of us, we have almost 20 to 25 years of experience between the two of us, and we would really, really, really just want you to know how many thousands and thousands of implants we have placed here in this office. I want to go over a recap of what is most important. The recap is you're going to brush daily, twice a day. You're going to water pick. We recommend at least twice a day, especially at night right before bed, okay? It doesn't matter what type of brand you use. I'm going to show you everything that we give to our patients here in the office when they come in for their cleanings, especially deep cleanings, because this also helps with your natural teeth. You're going to want to use mouthwash. You're going to use any type of mouthwash you want. They're all really good. They all specialize in different things. You find the one that works best for you, okay? It really does not matter if you're going to use Crest or if you're going to use Scope or you're going to use Colgate. That is a personal preference. You're also going to want to use a tongue scraper. Tongue scrapers also help get a lot of bacteria off of your tongue, especially when we're not drinking enough water and we're a little dehydrated. We tend to build up bacteria on the papilla of our tongue. So that tongue scraper will help get that bacteria off and help keep the mouth and the bacterial levels down, okay? Now, other than that, the main thing is make sure you're going to your dental office. Wherever your dental office may be, whoever you feel comfortable with, make sure that they know how to do dental implant cleanings. Make sure if you get this done that they do recommend that you come in to get your cleanings done. If they do not tell you that, then just know that this is something that needs to be done, and you may need to find yourself an implant center nearby to help you wherever you're located. We are here in McKinney, Texas, and we would love to have you come in and see us anytime, okay? So dental cleanings every 6 months, x-rays, checkups. This is your water pick, water flosser, whichever you prefer. Make sure you have one that has several settings, because again, you're gonna need to make sure that you can build up to a higher pressure and it's comfortable for you, okay? Use your toothbrush, whether it's manual or whether it's a power brush. This is what we offer here in the office, okay? Another few things that you can use would be these little interproximal brushes. They're little brushes that'll help get in between. So let's just say you're eating something and you feel, let's just say you're eating popcorn. We don't usually recommend it, but who doesn't like popcorn at a good movie? If you eat popcorn and you feel like maybe you got a little kernel stuck under there and you absolutely can't get it out, you can try to use one of these little brushes. They sell them for like ortho and for people that are in braces to help get the little areas out that they can't reach. They have little soft bristles on them and they should be able to get under there nicely without hurting you too much, okay? Good thing about using these power brushes is that you don't have to buy a new brush every time. You just got to replace the heads every once in a while. So you can get different size heads for your, this one is for your water flosser and to get in between. And then we have different size brushes as well, okay? One last thing that I want to recommend is the super floss. This is floss that you can pretty much get underneath. It has a little pointy end that will be able to slide underneath your prosthesis from the front to the back, and you'll be able to grab it on the other side like a thread and a needle. This has very furry little bits that's very soft underneath, and you can also get under there and kind of like you would floss your natural teeth, but except you'll just go sliding it side to side in between the gums and the prosthetic, okay? This will also help you get it and keep it super clean. You do whatever works for you, but these are your options, and we just wanted to make sure you knew that. So if you, again, don't go for your cleanings every 6 months, you could possibly lose your prosthesis, you could have major implant failure, and you may have to go through those surgeries all over again. So let's just make sure we don't do that. If you're finding these videos super helpful, then please be sure to click on our next video. We're going to continue answering all your questions and concerns and continuing to educate as much as possible. You can always click on the link below if you're interested in coming to see us, or you can give us a call at 469-625-0005, and somebody from Summit Point Dental will give you an appointment for your free consultation. Thanks again for watching, guys. Have a good day.